Welcome to the Take Care of Yourself Men's Health and Wellness panel discussion for Homecoming 2020. We felt it was important to talk about our health, particularly in these crazy times and these unprecedented times of health pandemic, social unrest, financial crisis, all types of things all working together to affect our health, literally to affect our health. And as Black men, primarily Black men who are Morehouse graduates and Morehouse students, there are certain things obviously that affect us that really aren't discussed or talked about in our community. So to that end, and it's interesting because we never really discuss these things during any official homecoming things. On the Saturday prior to homecoming, there's usually a beautiful breakfast produced by the Thomas Blocker Society, and in lieu of that, this year we're gonna start to try to put some more things that are official on the books, talking about our health as well. So to that end, I've got some outstanding Morehouse graduates with me here today. I'm gonna go alphabetical here, okay? Alphabetical. Dr. Jordan Brunson, DDS from the class of '02. Say hello, Jordan, please.
Hello.
Thank you. Okay, Dr. Jordan Brunson. Also, Dr. William J. B.J. Hicks II from the class of '02.
Hello, everybody.
All right. And Dr. Thomas Oden from the class of '04.
Greetings, everyone.
An outstanding class. May 16, 2004 was one of the greatest days of ever in the history of Morehouse College. Outstanding day. Anyway, having said that, they all three have obviously unique specialties and are accomplished in their own right. And I will ask them now to each introduce themselves, I guess, properly and let us know what it is they do in their specialty. And then we're going to get some questions. So we'll start with BJ.
So I am a vascular neurologist. That is a neurologist that has subspecialty training in the field and in the treatment of stroke, either hemorrhagic or ischemic strokes, meaning bleeding or non-bleeding strokes. So I take care of patients from the pre-hospital environment, meaning before they even get to the emergency room, with what we run in Columbus, Ohio, which is the Mobile Stroke Treatment Unit, which is an ambulance that is solely dedicated to stroke care, as well as emergency room care of the stroke patient, as well as their hospital stay, and even afterwards in the outpatient setting and clinic.
Wonderful. All right. Thomas.
Hi. So my name is Dr. Thomas Oden. I'm a psychiatrist. My specialty is in adults and forensic psychiatry as well. Spent a number of years working in different hospital settings, so ER settings to inpatient psychiatric hospitals, as well as doing consulting work for general hospitals that needed to collaborate with a psychiatrist with patients that would have a pre-existing condition or medical problem and they are having mental health issues as well. I'm currently in private practice in Atlanta, located in Midtown. I offer adult psychiatry therapy. I also work with patients who have had, maybe side effects to medications in the past, and they want to figure out there's some alternative options to try out. And so oftentimes I will use a prescription medication and combine it with maybe a herbal supplement and combine that to see if that helps patient symptoms. I also teach at Morehouse School of Medicine, oftentimes involved in teaching them how to interview patients, as well as helping them with clinical case scenarios. And that's mostly it.
All right. Thank you. Next up, JB. Dr. Jordan Brunson, excuse
me. Okay, my name is Dr. Jordan Brunson. I am a general dentist. I have a few practices outside of Atlanta: Palmetto, Georgia; McDonough, Georgia; Zebulon, Georgia. I work with everybody from kids to geriatrics. I see all patients, all manners of dental issues. I do everything from root canals to braces to sleep therapy, which is something I'm getting deep into right now. And I look forward to the discussion.
Well, thank you all for your introduction. I'm Joe Carlos, Associate Director of Alumni Engagement at Morehouse. The shortest introduction for this, because I don't do nearly the things that these guys do. Good Lord. And I just want to say, Oh, thank you. I appreciate it. But I appreciate that, BJ. But my father is a obstetrician gynecologist who retired in May of 2019, and I've always had nothing but love and respect for the work, obviously, that our health professionals do. But I think we don't really recognize how important those things are until they immediately affect us. And to that end, I'm 46 years old, and admittedly, I was going to get somebody else to do this panel, but I think I need to hear your advice more than anybody else, or as much as anyone else. So I'm 46 years old, and I haven't taken the best care of myself. And I think like many of us, like many of my peers, I think we just think we're just going to keep going and it'll be fine, and we can eat what we want to eat, and we can be neglectful of certain things, and we're impervious to a number of other things. But I think we've found that for any number of reasons, things appear in our lives, health-wise, that complications, obstacles, direct issues due to hereditary things and just things in the bloodline, things that occur. And I know y'all are going to say it in the proper way. I'm just saying it in my poli-sci major way. But having said that, one of the reasons I want to get you all together is, like I said before, to talk about some of those things. And it's interesting because BJ, first, because you obviously you're doing your work. You said hemorrhagic. Did I say that correctly? Did I say that? No,
you
I
did.
didn't say that.
You did.
I'm feeling good today. Okay, hemorrhagic. But you talked about strokes. That's one of your major specialties. You're on that the board, the Midwest Division board. They're looking at strokes, and obviously we know it is a silent killer. So I've read and in research, particularly for today. What are some of the signs that we can look at, or some of the advice? What is some general advice, or some of the things that we need to do as men and as Black men to do our best to curb or prevent the possibility of stroke?
Well, that is a loaded but very important question. No, I appreciate it, and I'll have to keep track of time because I could run my mouth on this all day long, and all night long, I should say. But what I do outside of my day and night and weekend job is advocacy, and that you kind of mentioned my board work with the American Heart, American Stroke Association, and that is to ensure that everybody understands the stroke signs and symptoms, and everybody understands things that they can do proactively before you even get to the point where you're meeting me in a clinical scenario. So the first thing we have to know is, what are the stroke signs and symptoms? And in medicine, we use acronyms a lot. And a real easy one is BFAST. So B stands for balance. And, again, to backtrack a little bit, stroke is a sudden event. It's a sudden either blockage of a blood vessel in the brain, where you're having a sudden change in your body. We call it a neurological deficit. You can't move one side, you can't speak very well, these sorts of things. And that either happens when a blood vessel's blocked, or if a blood vessel bursts. That's that hemorrhagic stroke that you were referring to. So if you suddenly lose your balance, and for no explainable reason, that's a stroke symptom. If you suddenly have a change in your eyes, if you lose vision in one side of your visual field, or if one entire eye you lose your vision, or if your eyes are moving one way or the other, that's the stroke sign and symptom.
Okay.
So that's the B part. The F is for face. If your face suddenly drops, if it droops, you ask somebody to smile and it's asymmetrical, that's a clear-cut stroke-like symptom. A is for arm. If you have them raise their arm up and one just continues to drop, or you can't lift it up whatsoever, or even if there's a subtle drift, that is a stroke symptom. And along with along with your arm, the same goes for the leg. S is for speech. If you suddenly lose your ability to speak clearly, if it's a slurred speech, like, it's homecoming, it's like 3 p.m., we've all heard that kind of slurred speech. So a different type of slurred speech would be unexplainable slurred speech like that. Patients will say, I sounded like I was drunk. Other times, if you cannot get your words out the way you'd like to, you're kind of searching for the word, you can't get any words out, or if your words are nonsensical, like a word salad. That is a serious stroke symptom. So that's the S in be fast. And then finally, the T is for time. It's not time to, ask a neighbor what's going on. It's not time to text your friend or your family member. It's not time, to call your primary doctor's office if you have one. It's not time to kind of hit me up on social media or whatever. Hey, is this what's going on? It's not time to Google. It's time to dial 911, because time is of the essence. Stroke is a preventable and treatable condition, and timing is everything. So that's really the one thing that I really want to ensure that everybody is aware of, because stroke is treatable as well as preventable, and we can get into the prevention stuff a little bit later.
Wow, thank you. Okay, I'm going to really be paying closer attention to those things when they thank you so much for that. Be fast, okay? And remember that. All right. So as we appreciate that, BJ. So as we talk about that, and I've been on all kinds of, I've been part of health panels where we're talking about wellness and health. And actually, after this, we're going to have a yoga session from a gentleman from Dallas, Texas, named Turner Cooper to talk about wellness and centering us going into homecoming weekend. But as we talk about that, I think in many cases I never hear anything about dental health. I never hear anything about dental health, and I'm sure the dentists like yourself, Jordan, are kind of like, man, y'all never, BJ gets time, of course, talking stroke, you get the orthopedics, those guys, you get the urologists, they get their time, the psychiatrists get their time, but nobody ever talks about teeth, and we've all got them, and hopefully we all keep them as long as we can. So it's interesting, Jordan, I have a 6-year-old, and our teeth the tooth evolution has been a very interesting one. My daughter's losing teeth right now, but as we get older, obviously, some of the habits that we start when we're younger, either we keep them or we get away from them. So what are some of the, other than the obvious, or maybe it is obvious, but what are some of the best tips for that 20, 30, 40, 50, those different stages and up, about, oral health or dental health? What are some great advice and tips that your Morehouse brothers can learn from you?
Well, first of all, again, thanks for having me, representing dentistry. So as far as your oral health, most people know that, brushing twice a day, flossing, rinsing, those are normal, everyday common knowledge things. Yeah. One of the things that I guess dentistry has made more of a push towards medicine, I will say for my patients, I've started taking their blood pressure. It's like something small, but people see me twice a year. If they're lucky, they see their physician once a year. Most, especially Black men, we do not go to the doctor. A lot of times they will come to the dentist. Their wife makes their appointment and they show up. So it's like a thing for me. I'll say, hey, let me check your blood pressure really quickly. And, they will, for a lot of us, we have high blood pressure. A lot of that is manifested in your gums. I mean, bleeding gums, people will say, oh, it's just me. There's been a lot of studies now that shows your body chemistry is your body chemistry. That, if you do a lot of buildup, have a lot of plaque, especially in that 6-month period, I mean, the plaque builds up in your mouth, but it also builds up in your arteries and your blood vessels. Plaque is a plaque. There's a lot of correlation between the two. There's 2 entrances to your body. I work in the friendlier one, in my opinion. So,
I agree, you do.
So, I mean, that's one of the main things. Another is to, especially when we're dealing with COVID and, all the stress that people are going through. There's been an epidemic of broken teeth. People, taking their stress out, grinding and clenching at night. So paying attention to that. Paying attention to your, as I said, your breathing, your airway, especially when you were talking about your daughter, mine, same. If your kids are snoring, that's not cute. Your kids are not supposed to snore, You're not supposed to snore.
My baby girl never snores.
Especially your children. I mean, I've seen a lot of parents say, "Oh, it's cute." It's not. It's an airway problem. And if you have a decreased airway, diminished airway, it's all kinds of things, that come from that. Attention deficits, and I could go on and on. As BJ said, I can talk all night about this. But the biggies, just pay attention to your body. Make sure to take care of your teeth. You're only given 2 sets, but if you think about it, really 1. Because of the food that people like to eat now, dentures are not cute. It's hard to eat a salad with a denture. You can eat, pudding and steak and gravy and stuff like that, but going to Ruth's Chris is not the move with false teeth. I'm just saying. That's all for now.
Thank you. Thank you, Dr. Brunson. I appreciate it. Man,
Jordan, can I cut in for 1 second? You mentioned you check blood pressure at the dentist's office. I've never experienced that personally. Is that a Dr. Brunson-ism, or is that something that, is becoming more commonplace in the dental community? Because I find that, profoundly impactful that a Black male dentist is checking blood pressure for his patients.
It's, being perfectly honest, it is, I don't want to say it's a Black thing, but,
No.
My mother had a syncope event in church, and it struck home because I said, well, when was the last time you went to the doctor? She said, I went to the doctor last month. I said, did you have high blood pressure? She says, well, no, it was the gynecologist. And I said, well, when was the last time you went to the regular doctor? She said, well, I go to the gynecologist every year.
Every year.
This is my mother. This is an educated woman with multiple degrees. So, and my father was worse. It was sometimes, it's like, well, when did you go to the doctor? And it's like, So I started doing that. I said, well, let me start taking blood pressures. And it was because of us a lot of times. Now, most of my patients, I mean, I do it on everybody. I don't want you to think I'm, but, looking at the health of African Americans in the United States, I knew they saw me.
Yeah.
They might be fearful of going to the regular physician or, and a lot of times, I'm a primary care conduit to a psychiatrist, to a neurologist, because I know a lot of them too. So I'll say, you know what, you really should go see the ENT. And they like it because in their mind, they're skipping a step, but at least they're getting some help. I mean, so that's the way I look at it.
That's fantastic.
That's a great question, BJ, because I've never had my blood pressure taken at the dentist, and I went to only Black dentists in Dallas where I grew up, and I've only been to Black dentists here. So it's interesting that you say that, and thank you for that. Thank you for the reasoning behind that. Now we know it's 2020 and it's October 2020 and going into homecoming, and today I saw a film that we're going to air. Actually, tomorrow night, right before our Jazzy Jeff, or actually, excuse me, tonight, before our Jazzy Jeff and Fresh Prince, Jazzy Jeff set. Jazzy Jeff is spending the night. That's not important. I saw this film about homecoming, and I got emotional. And I got emotional. I'm a crier anyway, okay? So, but I got emotional, and I'm saying this now, and I'm recording it. Gosh. So, but I got emotional. That's a lot of growth, Theo. I got emotional because I said I'm going to miss homecoming. I'm going to miss hugging people. I'm going to miss seeing people. I'm going to miss the smells. I'm not going to miss the stress of putting it on, but I'm going to miss that closeness and I think many of us are just in a number of ways going through or working through some level of stress or anxiety or just mental fatigue or any number of things. And so, Thomas, what have you been seeing? As a psychiatrist and as a professor at MSM, and you have your own practice, and you've got just an extensive career. I just remember when we graduated, you were doing like a postbac or something, right? And we finished in '04. You were working with some. I remember you were back in Atlanta already doing something before you went up to Boston to school. But what have you been seeing? What are some of the things that you've been seeing that people are going through, and how are they coping? And and that's all I got. I'm just going to sit back and listen to that.
Yeah, sure. So just to make a little segue point, I wanted to pull up a blood pressure machine that actually you can buy at any type of pharmacy. You put it on your wrist, So if you're over 25 and you're only checking your blood pressure and you see your doctor once a year, you are making a big mistake. Okay. I repeat, if you're only checking your blood pressure, you're over 25, you're only checking when you see the doctor, you're making a big mistake. All right. You just buy it. It's a good investment. You can just put it on your wrist, take it while you're sitting down, then stand up, take it again. If you do it 3 times within a week, that'll show you your average. If you're running pre-hypertensive or hypertensive, I just wanted to add that since we've been talking about that. But what I'm seeing as a result of the pandemic, first of all, hate to be the bearer of bad news, but the World Health Organization already saw that depression was going to be the leading cause of disability and the leading cause of having complications of pre-existing medical conditions prior to the pandemic. And so all the numbers weren't really looking good when it came to increased rates of suicide in the US population. And when you start talking about the African-American community, we were really struggling with depression, anxiety that wasn't really being treated, PTSD that wasn't really being treated because due to the disparities, we weren't actually accessing these tools to help us. But what I'm seeing primarily as a result of the pandemic has been increased rates of depression, insomnia, anxiety, as well as substance use. Everyone is dealing with the shift in the culture, the shift in their schedule and their structure. We're all walking and moving less. And so what I'm seeing with oftentimes when I'm talking to individuals who are coming in for depression or anxiety or whatever issue, I'm asked, okay, so, things have changed as a result of the pandemic. How's your physical activity? Because we're all moving less. I mean, just look at homecoming. We're going to go to tailgate and walk around all day and walk to this campus, that campus, and we have a cumulative loss of movement. And the body keeps score, that adds up. And so everyone's moving a bit less. The structure has changed. Now you're home, the pantry's right across from you. Now you're seeing the junk food. And before it was okay, you can go home after work and have a little bit of a nightcap and you have a drink or two. But now you're probably starting a bit earlier than you did before. You're probably eating things you normally didn't eat before. And as a result, things are a bit awry. And so I'm seeing depression, insomnia, anxiety, the social isolation, that's a big component of depression. So when you're depressed, you can have trouble sleeping. You have decreased interest in activities that you normally, would enjoy. You have a low energy state where you may have a hard time getting up in the morning. You may find it difficult to concentrate on things at work as well as at home. And a good landmark for that is like something that, maybe reading something would take a shorter period of time. You're noticing, you have to reread it again, or it's taking longer to read. And a feeling of hopelessness can also be a marker for depression. Anxiety is usually a sense of worry. So, you have this fear that something's bad's going to happen, or you might notice that your mind's racing, is going from one topic to another topic, and you can't really seem to find your peace. So anxiety is a persistent state of worry. Insomnia is just straightforward. You have trouble sleeping. Some people have trouble entering sleep. Some people have trouble staying asleep. And as a result of all the shifts in our ability to interact with each other, having more increased isolation, maybe more work stress when you're working from home and your spouse or your partner, you're having different issues with spacing. You have the kids around, they're homeschooling. It's a lot of stimuli at once, and everyone's being impacted with that in different ways. So I do want to go into different tips that you can look out for, but I want to just kind of stop there. But I am seeing those particular issues definitely spike up as a result of the pandemic.
Thank you. The takeaway, first of all, the blood pressure machine, it's interesting. We have one in the house from when my wife was pregnant with my daughter, and she didn't have a great number of complications. My wife didn't have a number of complications until the end, and it was all blood pressure related. And so I was looking through a drawer the other day and I found the cuff, and I just thought about it, Thomas, when you said, 3 times a week. Like if you have it at home, take it 3 times a week so you know your average. Because really, unless I'm in a CVS or a drugstore or a grocery store, I might go do that then. But And I'm usually surprised when I get to the doctor and I try to do my breathing a certain way so it'll calm down or something like that. So to try to affect it, like, as though I can trick the body, like it's the body. So and I don't even know what I'm gonna, like. I don't know how that's even gonna. Of course, there's no difference whatsoever. Obviously, I learned turning. Like when my wife was pregnant, it was a different. Her blood pressure was different when she was on her side than when she sat up. I did learn that. So when you mentioned sat up and sitting down, but one of the key takeaways so far, and y'all are giving us so much great information, is checking his blood pressure, because it's obviously it unlocks or goes in a lot of different directions, and not good ones when that's going unchecked.
Can I just give a shout out to Morehouse and to Dean Thomas Blocker for raising us, and you know, I just cannot believe I'm on a homecoming call with two Morehouse doctors who are in dentistry and psychiatry, and they just broke down hypertension. I mean, I'm sorry, that is rare, folks. That is rare, and that just illuminates the importance of Black male physicians. I mean, there are, you know, physicians, dentists, you know, health professions, what have you. There are not a lot of us, and hypertension, high blood pressure, that is what we call in the business the silent killer. You know, that along with smoking, that's 80% of stroke. You know, those two things, those are modifiable risk factors. That's a fancy way for saying if you cut it out, you're good, you know. But what has negatively impacted us as a people is that we're not in front of health professionals that look like us. And when that happens, they, you know, those that don't look like us may not be up on what is killing us. And high blood pressure is one of those things. So, you know, again, I just had to, you know, call a timeout, a little 20-second timeout real quick and do my little praise dance on it. Yeah. Give me my 20. But no, I mean, it's that serious. You know, the American Heart, American Stroke Association, around 2018, they changed the guidelines for high blood pressure because they looked at everyone and they said that our previous understanding of high blood pressure was, you know, didn't quite cut it, you know, so they tightened the definition of it. So if your top number, if your systolic blood pressure is greater than 130 consistently, you know, if you're checking like Dr. Oden just said, you know, throughout the week, and if you're consistently greater than 130, that's by definition hypertension, you know, and if you're consistently greater than 120 systolic, that's the top number again, then that's elevated. So that's half of us. Half of African Americans automatically, boom, half, 50%, half, 1 out of 2, you on the yard, 1, 2, hypertension, 1, 2, hypertension. You know, so that's what we have to understand. And, you know, we all have that false sense of invincibility when we're in our 20s and we're in our 30s. But guess what? 20 and 30-year-olds meet me in the stroke world. So, you know, and again, going back to what's a big modifiable risk factor, it's high blood pressure. So, you know, just being unapologetic about knowing your numbers, knowing what your blood pressure is, getting that blood pressure cuff out the junk drawer, you know, and putting it to use, or getting on Amazon, or, you know, next time you're in the drugstore and saying, oh man, it's just like $20, $40. Let me just have it, you know, and just kind of being proactive about that goes a long way, along with other things, clearly.
Yeah, I'm about to go get it out the drawer. I know exactly where it is. I'm sorry, I got it. I got to do that. And it's interesting that Thomas, as a psychiatrist, you said it. And I don't think I paid attention before, but to how many, just the effect and how important it is to all those other things about wellness and just health. And Jordan, you said it, and I know I've never had my blood pressure taken at the dentist office. Like I know that's never happened. So I didn't even assume that there was a blood pressure machine, like that they had the ability to do so. So having said that, that's amazing in and of itself. So, and thank you, BJ, for that. It is surreal. obviously, I look up and I say, gosh, I grew up as a doctor's kid, so I knew a lot of doctors. But when I went away to school, I guess I kind of took it for granted. And I look up and I'm like, no, they were bio and stuck with it or whatever and stuck with it. And now these guys are literally doctors. And God bless Thomas Blocker as one of his acolytes, not academically, but he was an advisor to a couple of clubs I was in, and also my first work study advisor. Signed all my hours. Never really paid attention to what hours I was working. He signed them off. So God bless him for that. But God bless Thomas Blocker. I'm sure he's up there smiling right now. Having said that, actually, Thomas, you were about to give some tips. Mm-hmm. You were just about to give some tips, and we're seeing in the last week, I've heard more people tell me about fatigue from looking at a screen.
Right.
Literally from being sedentary, and you talked about being stationary, the lack of, we're not ambulatory as much as we once were. Just earlier this year, this seems like 3-4 years in one, which is, I can't be good on the body, just cannot be good on the body. But you were talking about, just general fatigue and
right.
things that we are, I guess, going through, and many of us are going through. What advice do you have for us for that fatigue, just on a daily basis? Because where I'm sitting right now, I spend a lot of time here. And I got a nice, I got a beautiful 32-inch screen right here. Got a soft light in my face. Got a lot of space here, but I spend a lot of time sitting right here at this chair, working. So, but in general, just what are just some things that you feel that we could, some tips?
Sure. So when I first interview patients, one of the first questions I ask is about sleep. How are you sleeping? Do you have trouble entering sleep? Do you have trouble staying asleep? And many people right now are having issues with sleeping. They may find themselves up, much later than they were before. They're noticing that their mind's racing more. It's harder to enter sleep because there's just so many things in their mind. I think it's just really that lack of structure. The structure of our culture has been shifted as a result of the quarantine measures. And so what I've been recommending often is for someone to prepare for sleep. Whatever your target time that you want to sleep, you want to start the preparation 2 hours beforehand, okay? So you want to just put yourself in a relaxing state. And that will include at some point having to make a cutoff time for when you engage in social media, when you're using either a laptop or using your cell phone, because the light definitely disrupts our brain system of releasing melatonin that helps us sleep. It confuses the brain often, these lights. They weren't really made, these systems weren't created to have your health in mind. Okay, these social media applications were designed for you to spend more time on it than you think you spend on it. So you thought you were just checking an email and checking Instagram for about maybe 5 minutes. You look up, it's been 15 minutes. They're getting better and better and making these algorithms to kind of get you sucked in. So we're all taking in more screen time as a result, and that's definitely messing with our bodies. And so I tell someone to prepare. If you want to get to sleep for 10 p.m., 8 p.m. is when you want to start the wind down process. Now that wind down process can just be different from person to person. That could be taking a bath, that can be taking a shower, relaxing your muscles. You may want to get your to-do list. If your mind's racing because you're thinking of all these different things to do, get your to-do list done the night before. That's okay. So now you're not at night tossing and turning, figuring out, okay, what do I do tomorrow? You already have it listed there. It's, hey, I wrote it down. Okay, fine. But you want to start the process. That also includes maybe listening to more relaxing music. You shouldn't really watch CNN right before you're going to bed, because it's all meant to really excite you. So anything that's bringing up emotions is probably not a good idea before bedtime, especially if you're having trouble sleeping. So relaxing music, trying to do something that relaxes your body. That can be, some people get more energized when they exercise, so that might not be great for everyone to do that in the evening time. There's also journaling as well, that can be useful. But there's also, not to get into Yoga Nidra is not like doing, you're not doing poses or stretches. Yoga Nidra is actually different because you're lying down on a hard, flat surface like the floor. Your arms are stretched out. And it's a guided meditation in which you are bringing attention and focus on different parts of your body. So they're just guiding you to focus on your left toe, to your left shin, to your left knee, your left thigh. And so by the end of it, you're actually taking all that chatter in your mind and you're concentrating those efforts in different body parts. And so that will actually help to center you before you're going to bed. But if you actually start your sleep routine, and whatever that may be will vary from person to person, at least 2 hours before you go to bed, you're more likely to have a restful sleep. but it does take some effort and trial and error with that. There's also an additional amount of, these health apps that are coming out more and more now, with the phone and as with watches, and that can help track your sleep over time as well. But I think those are really good tips when it comes to sleep. I can go into depression too. I don't want to take up all the time, but it just depends on, I can stop there and we can get back to it.
Well, we'll circle back to depression.
We're going to have to talk
depression.
about that, right? That's not in there. Oh,
We'll circle back to it. I'm not running from it. I'm just saying.
I can talk about
thank you. No, I appreciate it. Thank you for that. Thank you for that. So, Jordan, you said you also started sleep disorder or sleep study work as well, and I never thought about it from so what have you been learning as well in your research in that regard?
Well, as Dr. Oden was talking about, sleep is huge. It's huge to your mental health, your overall physical health. It's difficult to navigate a day with a bad day of sleep. And then when you start sandwiching it, there's people going on years of not sleeping. My focus is more on breathing during your sleep, AHIs and, respiratory, like when you stop breathing, apnea events. Think of, I always in my mind think of Reggie White. His wife is a huge proponent for, testing, sleep studies. But from a start, exactly as Dr. Oden was talking about, is preparation for sleep. We're big into, as he is, holistic. We do a lot of, I guess I'll say alternative medicine or Eastern medicine, diffusing different essential oils. There's a lot to go with what's around you, as he was saying, with the televisions, with the screens. And that goes for your children as well, limiting your screen time with your kids or limiting the kids' screen time. My daughters during the week, they'll tell you they don't get their iPads. And my daughters have iPads, iPods, iPhones, all of that stuff.
During the week? In the pandemic?
Yeah.
God bless you.
Nope. They got it. Did you have one?
No. I had a G.I. Joe.
Look at how you turned out. I'm just being perfectly honest. When you look at Steve Jobs and those people's kids, they're not on the iPads and iPods and stuff all day. They get it on the weekend.
Yeah.
And they can do with that. I realize, in their minds, they're being stunted, but that's how they learn how to think. And nobody's telling them how to think.
No, Jordan, it's interesting you say that. So we used to do that. Like, that was our thing. We used to do that.
Mm-hmm.
It was only on the weekends, and so Friday night wasn't the weekend. I'm talking about Saturday. It was Saturday and Sunday, and not all day either. Until we just let it die. And then now she's very clever, and uses my my iPhone 11 charger because it's the supercharger, right? So she can get it going. But it's interesting. We've gotten lax about it, and because we're working and we're trying to work, and so we've kind of gotten lax. Like after school, that's what. But she's in. So after school, it's interesting. We kind of let her do that. But I hear you about the screen that we got to get back.
Well, it's everything has gone smart. Like now, a lot of my patients, the toothbrushes they're on. If I was like that into it, I can log on and see if they're brushing their teeth. There's apps. Your Crest Power toothbrushes. There's an app like your dentist can see if you're brushing your teeth. Or they'll say, "I brush twice a day." I'll let me see your phone. I can see. It's like you don't brush in the back. You see, you don't brush in the back. It is that pinpoint now. Is we live in this. I guess I'll call it smart culture.
Yeah.
And in order to function, that is one of the things that I notice, especially with Black men. It's like every man in my family snores, like loud, like I'm saying me. Yeah, me too. And I didn't know. And my wife was just done. She made me go get a study, and I was wearing a CPAP. And the thing with the CPAP, you know, if your AHI is low enough,
Please tell us AHI. Well, tell me and everybody else who doesn't know, like everybody else, other than the three of you, what AHI, what AHI is.
So I keep saying AHI, but it's basically, think of it this way. Every time in a minute, okay, if I'm watching you at night, how many times in that minute do you stop breathing?
Okay.
So, and that's like, you know, multiplied, okay, out. So when you have a sleep test, you go sleep in this center. Well, now a lot of times you do it at your own house, but it used to be that you would go to this center and they'd watch you sleep during the night, and you'd be on all these machines and monitors, and they would see how many times you stop breathing, how long you stop breathing, when you would stop breathing, and the struggle. Sometimes they'd even videotape you. So to show you how serious it was, they'd show it to you later, and you have a whole minute doing, you know, like this struggle breathing. And when you see that, it shows you how important it is to put on that CPAP, because if none of you have seen it, it's like this, you're attached to a machine on the edge of your bed. Okay. And that puts positive pressure in your mouth, which keeps your airway open, which is great, except, you know, not the most romantic looking thing when you're sleeping with your significant other. So the dental world has a device, and like I wear one now, and it basically just advances your jaw, which opens up your airway.
And that's helped you.
What's that?
That's helped you such that Lisa is not.
Yes, it's sexier.
Yeah.
But I mean, at the end of the day, you know, what this does, like if you have the events where you're not breathing and things like that, you know, what ends up happening is you don't really suffocate. You generally trigger having a heart attack or something.
Yeah.
It's not a good way to go. And it's generally those people that you were like, he was so young, he was so vibrant, and the next thing you know, bang. Natalie Essex's fiance, that's how he passed. You know, so
this is the whole point behind caring and spending this much time on sleep and sleep apnea, you know, and basically when you're gasping for a breath, it's when your oxygen level has desaturated, when you have dropped, you know. So one part of the sleep study is they will say that, oh wow, when you had that desaturation, your oxygen level was only 80%. It was 70%. So normally it's 96 and above. So that's a significant amount of lack of oxygen to your brain. And we're learning more and more about sleep. You know, neither of us, you know, are quote unquote sleep doctors, but, you know, in the stroke world, that is a risk factor for stroke. So when I see my patients in the office and I say, yes, you had your stroke 2 weeks ago, and now we're talking about what can we do to make sure this never happens again, I bring up sleep with every single one of my patients. And I bring up the fact that, do you snore, or do you have any of these other classic symptoms that Dr. Oden and Dr. Brunson talked about? And if there's yes to any of those, then I am recommending that they get tested to make sure they have apnea or not. And I say, look, I'm not going to get, you know, because everyone's afraid of the mask for reasons Dr. Brunson just mentioned. It's not the sexiest thing in the world. It's effective. There are other methods. But I will say that it is a risk factor for heart disease and stroke. It does raise your blood pressure. It increases your risk for AFib. All of these things increase your risk for stroke, for subsequent strokes. So these are significant things that we can't turn a blind eye to. And then I have one anecdotal story from Morehouse. You know, my brother's very close friend, and shout out to my brother. It's his birthday today.
D Hicks' birthday today?
So big shout out to D Hicks, and one of his very close friends who shall remain nameless. When he was in grad school, he tells me the story that, you know, he was with a lady friend, and she said, "You are the loudest snore I've ever heard. My dad has apnea. You have to get checked out. I know it. And he said, "No way. I'm thin. I'm this, I'm that. I was this athlete. I was a great guy." Lo and behold, he had severe apnea. And the docs, he went to a very reputable center, and they were shocked. They said, yeah, you fit the description of an athlete, but you're worse than any of our 400-pound, classic walking sleep apnea patients. So, it can be anyone, and it has serious downstream consequences if we're not taking it seriously.
You guys are blowing my man. We got to do one of these.
I do have a question. It's actually not about breathing. BJ, is how often are you, when somebody has the high blood pressure, a lot of the stroke risk, maybe they had a stroke, do you generally do you prescribe a dietitian? I mean, I know diet has a lot to do with it, and it's not just like the traditional, I stopped eating fried chicken, I should be fine.
Mm-hmm. Yeah.
No, that'll do it. That'll do it.
No, that's great. And again, this falls into mental health, all of this. We all know that food is life, and I tell this story all the time. When I wanted to get into stroke and, I really got interested, it was before I got my subspecialty fellowship training. And I would see patients in the office and I'd say, you had this stroke, you got to start eating right. And I was training in Detroit at the time. And the patients would tell me, okay, well, what's that mean? Like, what do you mean by eating right? And I'd say, because you don't learn that in med school, or at least you learn a little bit of it, and that's it. So it was almost like, man, they're giving me homework, because I could say, yeah, you got to eat right. You got to eat your fruits and vegetables. It's like, that rings very hollow very fast. If you're not, because, you're coming with it with all the facts, with all the data, you're quoting all the studies, you're talking about all the randomized controlled trials about this medication, that medication. And then when they're talking about something like, what am I putting in my mouth to eat 3 times a day, or maybe multiple times a day, and you're coming with eat your fruits and vegetables, like, come on, man. Like, that's why people, distrust the medical establishment, even if it's coming from somebody that looks like them. It's like, oh man, you just like they are. I thought you'd come at me a little bit better. So I say that to say, thankfully, once I started looking into this, it kind of corresponded to the rise in great data about the Mediterranean diet. So there is great data with the Mediterranean diet on vascular health, heart and brain health, diabetes as well, controlling diabetes at a better rate, as a neurologist, cognitive impairment, all of these things, blood pressure. So there's a lot of great data there. And of course, we all know that kind of plant-based diet and everything, there's positive effects to that as well. A lot of people push back on that because, that really requires a big lifestyle change. The Mediterranean diet, I like to tell people, you can still kind of go to a restaurant and be able to choose things that adhere to what the Mediterranean diet is. And it has the term diet at the end, so it kind of makes it sound like it's a fad, like it's going to be gone. But when you think about the origin of it, a lot of, societies historically that were near bodies of water, they adhered to these types of eating. So it's really no kind of brand new thing. It's not like you're going to get this 1-900 number and they're going to send you the Mediterranean diet in a box. You can eat that and eat that well. So I always tell people to look into that as the healthy way to eat for heart and brain health and for everything else. But I go there every time. My stroke clinic, again, once I started seeing patients at a high clip, I knew that the best part, the most effective part of doctoring is knowing what you don't know and knowing what you're not the authority on. Because if you start talking big and bad, you're like a narcissist, and you should probably feel like you can run for president. So you can't. You have to know where the experts are. So we hired a dietitian with a stroke focus. So they see all of our new patients and all of our follow-ups as well, because I feel it's that important.
Awesome. I do have one more question, and it's sort of segs into it, and it's actually for Thomas, Dr. Oden. And it's not really about the food per se, but it is, about follow-ups. Both of my daughters they see psychiatrists, and it's more about stress, that they deal with. But everything has shifted to telehealth. And I was just wondering, in this COVID-19 era, do you think telehealth is a fad, or do you think it's here to stay?
It's definitely the future. I was actually highlighting that as part of my private practice, before the pandemic, because I knew that ultimately would help to enhance the access to care. Many patients, they want to see a therapist and they may have limitations based on transportation, but I'm like, well, now you can see with telemedicine, any therapist in the state that you're in, because they carry a license. So now that extends beyond the zip code of your region and getting from place to place. Some people will have feelings of embarrassment. Like, oh, what if I run into someone on the way to the office, or I'm sitting in the waiting room or something? And so to me, it really getting care from the comfort of your own home, to me is definitely a step in the right direction. Of course, there'll always be people that want to have an in-person relationship with a therapist or psychiatrist. I think that's great, and that's someone's preference, that's fine. But telemedicine is definitely here to stay. I feel like it's only going to enhance care, and ultimately, I think it is going to help with the stigma, because you're at home, you're more comfortable, you don't have to necessarily, try to show up for someone else, So I do feel like it's definitely here to stay, and it's really been a positive aspect of mental health treatment overall.
I would also say for access, I'm from, y'all are in the A, we everywhere. But guess what? I'm from the Midwest. I live in the Midwest right now. We around, but we're not around at the clip that you are in Atlanta. And it really comes to fruition when it comes to something like, I need to see a psychiatrist. I need to see a therapist. I want to see one that looks like me. Dr. Hicks, can you help me? And, my Rolodex is like less than this amount, you just don't have the numbers. And especially Black males, come on, like we just don't have it, So using telehealth in that way, so where you can be in Columbus, Ohio and say, oh, wow, I can log on and have a great rapport with a psychiatrist, a psychologist, a counselor, a therapist, what have you. And they may be in Atlanta, they may be somewhere else, but guess what? They are with me right now, dealing with my, Black male, Black female issues that I cannot get, even if I'm face to face and I may have a psychiatrist's office right across the street from me. I'm not getting the same level of care. So I agree. I think it's going to be very, very big, especially now that, our community is finally coming around to self-care. In neurology, a lot of our people, we feel comfortable I'm seeing a brain doctor, so I'm going to go knee deep into all this. And as a neurologist, I say, I can diagnose you, perhaps, maybe a little wrong, but I can kind of get you in the ballpark of your potential psychiatric diagnosis, somewhere on that axis, 1 or 2 or 3. But you need to see a specialist, you need to see a professional. And that's that next step that, you may not have if you're practicing in places that don't have us as clinicians walking around.
Right. And to add on what Dr. Hicks stated, I'm actually licensed in the state of Louisiana, Georgia, New Hampshire, and California. So I have patients all over the place. It really helps me get an idea of the pulse of the American consciousness, what we're all facing at once. But that was really more difficult to do, before the normalization of telehealth services. So like Dr. Hicks said, it's definitely enhancing access to care.
So, man, I'm just loving how you guys are just riffing. This is a man. This is like my youth, just sitting back while Dad and his boys are just talking away. But they were all OBs, so it was usually about pretty much the same thing. But nonetheless, it's amazing to see this. I write about this, the variation of how varied this is, but to actually, be part of it is truly amazing. I was going to ask Thomas, Dr. Oden, going along those same lines when you were talking about your different licenses and Jordan and BJ, great that you brought up obviously the merits of telehealth, and I think it's something that's, well, Thomas, you said it's here and it's here to stay. You said it's the future actually, and even in education, we thought, shoot, a year ago I had alums, and I hope they're watching, arguing me down that we would never be the same with online education. We would not have remote learning. And it wasn't you, Jordan. I wasn't arguing with you, but it was some 60s alums. I hope they're watching. They know where they are. Arguing with me, saying it's not the spirit of this. Like, okay, well, it's 2019 at the time, and I was on a committee talking about how we were piloting our online courses.
Mm-hmm.
And now, after March 15th, 2020, Morehouse went online. Like, didn't have a couple of days to figure. We went online after we'd done enough research on how to get it done, and obviously there's wrinkles, but that's the future, and that's literally, we're going to always have some kind of aspect of it going forward. So it's interesting that telehealth is also with telehealth, one has that ability. Because I was thinking, well, if someone's used to going to see the therapist, literally going to see the therapist, and I'm thinking of Tony Soprano and Dr. Melfi, and then you talked about the stigma, and I'm always going to go to some Sopranos or some TV thing, but Thomas, you talked about the stigma, and on that show, if you recall, The Sopranos, he was hiding, ducking, dodging, going in and out, changing cars, doing all these things just to go to see his psychiatrist, right? Because of the stigma and because of what it would mean and all that kind of thing. But he was battling depression. And so we're going to come back to depression, and I'm going to come out because your time has been so valuable. We got a few more minutes, but he was battling depression, and someone who seemingly had it all, but had an interesting career with a lot of pressure, like many of us do. What are some of a couple things? What are some of the things you've seen from state to state that have been different, I guess? And you said you were in different parts of the country. What are some of the things that people have been? And I know you're a native, a proud New Orleans native. But what are some of the things that you've seen, Thomas, as it pertains to different parts of the country and as people are dealing with depression? And then what are some of the ways that one can really cope with coping with depression?
Mm-hmm. So I can't say that I'm noticing a regional difference in what's being reported for mental health. Everyone is going through the same thing at once. Now, they may communicate it differently. Someone who's younger may communicate their depression much differently than someone who's older. So like a teenager, for example, they're not going to say, oh, I'm sad, I'm down. They may become more irritable. They may be getting in trouble in school. Grades may be declining. That might be the way that they're expressing that they're depressed. Some people, their substance use, problems may increase. But with depression, oftentimes, by the time someone notices that they're feeling depressed, it's been going on for quite some time. And so it can really be a silent killer. It can exacerbate pre-existing conditions. It can decrease your ability and to really take care of yourself, which can cause a number of different health issues. And so there are a number of ways to treat depression. Now, a lot of depression symptoms can resolve by itself, but if it's been going on for longer than a month, then, usually if you're having more bad days than good days, I try to keep it simple like that. If you're noticing you're having more bad days than good days, if you're noticing that something, stressful happens and it just ruins the whole day, it ruins the whole week, those are clear signs that you're actually maybe struggling with depression. I know a lot of individuals, Black men, who work out quite a lot and they still have significant depression symptoms. And, they think that the character is being tested, their willpower is being tested. But I try to really reframe that and say, look, this is a brain disease. If we had a fancy imaging machine available showing what parts of your brain are active and not as active, we would probably notice in a clinically depressed person that the frontal lobes, the front parts, would actually be a lot darker and less activity, less blood flow taking place. So we do know that it's an actual brain disease. It's not about how disciplined you are and how bad you are. There's genetic factors, there's environmental factors that can contribute to that. And so I usually try to, recommend that someone just starts to weekly take some inventory on how their brain health is doing. And so, okay, how are you exercising? How are you hydrating? I keep seeing the joke of stay hydrated and mind your business. But I mean, it actually is valid. Hydration is definitely good for the brain. How are you sleeping? Are you really stimulating your brain with some active activity, something that you're learning about, some type of challenge, some type of new goal that you have? Those are all really good things for the brain as well. When it comes to connecting with others, we're all struggling with that right now. And I try to recommend, particularly with teenagers, that, you get more, your brain is more activated by a phone call compared to texting your friends. So you're on the group chats, you're you're on the DMs, but you're actually not engaging someone. But hearing someone's voice, hearing the inflection of their tone, you know, and you able to do that as well, that is very healthy for ours. We're designed to be social creatures, you know, so those are all healthy things for the brain. So you may think you're staying in touch with people by texting, but actually the phone calls, I mean, you know, because right now we can't all see each other in person, but phone calls are definitely more potent for our human connectivity compared to using the text, you know, the text groups, the text that we have. And so, you know, trying to challenge yourself with activities, you know, trying to make sure you have healthy habits. Those are all things that keep your brain healthy. But there are medication options for depression. You know, therapy can work very well with depression as well. Once you actually start the process of seeking help, like, okay, my mental health's not great, I need to get some help with this, you're consciously and subconsciously, you're going to start to focus your attention on that, and you are going to end up opening doors to receive the help, you know. So once it's on your mind, it's hard to ignore, and that's really a good part of starting the process. But if someone's really afraid of taking medications, of course, they have side effects. I do want to add that we, as a psychiatrist, we start the lowest dose possible because we know that these side effects can be very stressful for people to experience them. So we start, you know, at low doses. We usually will follow up with you at least once a month until we find a good steady state of the dose and make sure you tolerate it well. And I tell people all the time, like, look, if you try out and it makes you feel weird in a few days, just stop it. You know, let me know and we can start somewhere else. Okay, it's not going to permanently change your brain and cause these problems and cause you to be a zombie and all these other things. You know, where it's a medication trial. Let me know what's going on. We're starting at the lowest dose possible. It feels weird, stop it. But there's also some over-the-counter things you could do for depression as well. There's St. John's wort, you know, that's as classically used for depression. Doesn't help with anxiety as much, but some people have anxiety because of depression. They have low energy, low motivation. They're not getting things done. Now things are building up, and now they're anxious because things are going awry, you know. So sometimes that depression, anxiety, you know, they tend to kind of work hand in hand. But St. John's wort works with depression. There's also, I have this right here, you know, because I read about these things and I try it out myself. This is called SAMe. It's like short for S-adenosylmethionine. It's a natural occurring coenzyme in the body. Is used to drive a lot of metabolic processes. We do know that high levels of SAMe equates to high levels of serotonin. We have low serotonin that causes depression. And so that's something over the counter that can be used to help. It usually helps with, like, if you have a low energy, low motivation type of depression, it's very useful for that. But once again, it's not really great for anxiety. So there's a lot of options out there, but as long as it's in your conscious awareness, you are going to find a way and find different steps. But if you're noticing that therapy is not really cutting it as much as you would like it to, or talking to your friends, or prayer, and all those are very powerful tools, you know, just understand that there's more additional assistance out there for you, and seeking you should find.
Thank you. Wow. Okay. Well, on that note, if there's any other, we have 2.5 months left in 2020, and if there's any other, yeah, I know. I was trying to do the math, and I'm like, well, we just have 2.5 months. Okay, 2.5 months left.
But who's counting?
Yeah, but who's right? I'm a little more concerned with November 3rd right now than anything else. Yes, we have 2.5 months left in 2020, and I know that the advice and the things that you all have shared today will definitely help us get through that. And if there's any parting words that you'd like to share, please feel free to do so now. I'm going to just shut up. Please feel free to do so now.
I would tell people that they need to become their own advocate. I'll, you know, just being for myself, you know, not that I knew the brother personally or anything like that, but Chadwick Boseman dying, like, really affected me. You know, I had, you know, I mean, our black superhero was Meteor Man. I mean, I love Robert Townsend.
Robert Townsend's the best.
Yeah.
But he ain't T'Challa.
Yeah, I mean, so when that happened, you know, it was time for my physical. And I told my physician, I said, you know, I think I need a colonoscopy. And he was like, well, are you having these symptoms, bleeding stool, all this other stuff? He was like, you know, your insurance isn't going to pay for it. I said, well, I mean, what is it? And he said, it'll be about $1,500. I wrote the check because it gave me peace of mind. I think for a lot of people, you know, we wait for some symptom or something to come out, and I'll wait. And you wait, and then the next thing you know, it's too late. And I deal with that because from a dentistry standpoint, oral cancer, you know, you're talking about a silent killer. I mean, basically 9 out of 10 people diagnosed are, you know, that's it. They're dead. We don't catch it fast enough. We don't diagnostically screen really at all. And when it hits people, it's the end. I mean, if you're lucky, they dissect off half your face, your jaw and everything like that, neck gone. And if you're not lucky, they just say, have a good time with your family. But I say all that to say, I think we need to become better advocates for ourselves. Don't be afraid to ask your physician. You know, I've been feeling a certain type of way. I need a recommendation from a psychiatrist. I need a recommendation. You know, I've noticed my right arm's weak. I get winded when I go up one flight of stairs. All these are important signs. Don't just think, oh, you know, I'm just getting old, or all this is supposed to happen. So that's my advice.
Yeah, you don't want to meet me. You know, that's what I tell people, you know, when they find out, oh, you're a Black doctor. Oh, you know, your dad, you know, class of 70, by the way, you know, oh yeah, I remember him. He was a great doc. You know, do you have a card? Hey, you know, I don't carry cards because you don't want to meet me because my card is 911, you know, so to avoid that, you know, to avoid that, you know, you have to talk about the things we've talked about tonight, or, you know, today. And that's, you know, all of these things, you know, and to really have a great baseline to what Jordan mentioned, you know, getting that PCP, you know, and if you don't have one, it may seem like, you know, you're in a desert, and it's like, where do I start? This is, you know, hey, I didn't like bio. You know, I took bio 101, 102, and I was out, you know, at Morehouse, and I never looked back, you know, and I've always been healthy my whole life. You know, that's the type of stuff that ends up you meet me when you're 50 and you say, this never should have happened to me, you know? So you never want to get to that point, and you should really make a concerted effort, if you haven't already, to find a primary care physician that you can trust. I'm not a primary care physician, but I lean heavily on them. And I have a network of those that I know are great and will do well by my patients, and my patients that look like me, because that is the key to keep them out of the hospital. And we can no longer sit idly by and be satisfied with our mortality numbers and our morbidity numbers, meaning the disproportionate numbers of people that look like us that have medical conditions that are leading us to early graves. So, you know, it's 2020. We're all looking at everything different. Healthcare is no exception. And, you know, you've got to find that primary care physician that you trust, ask around, who does your friend know, you know, and then Jordan, to your point, once you feel confident with what you're doing, then you go to your mom, you go to your daddy, you go to your siblings and say, what are y'all doing? You know, so that's my parting shot.
All right, and yeah, just to piggyback off all of that, definitely see your primary care doctor. A lot of the referrals I get for my practice and psychiatry in general will come from a primary care doctor. They tend to be in the front lines of you know, really diagnosing depression, anxiety with a number of patients. So, you know, definitely that's a really good starting point. Again, you know, we're all moving less. You know, they say on average like 10,000 steps a day is recommended to be healthy. You know, there's all these tracking apps now. So, you know, just get moving because you're probably moving less. And just when it comes to the mental health component, it's just time to really acknowledge that our thoughts can impact our bodies. You know, our bodies can in fact impact our thoughts. It's all connected. It's not, you know, we learn that everything's so separate, but it's all one system ultimately. And so just check in with yourself. It's very hard to gauge your emotions day to day, So I oftentimes recommend that, just track how you were the week before compared to this week. If you do those types of assessments, you'll have a better gauge of how you're doing over time compared to the day to day, because sometimes things can snowball. And just remember that you don't have to wait until things get really bad to seek mental health treatment. It's accessible, it's there, it's actually a competitive advantage to being good mental health. It's hard to reach your goals when your mind's kind of going different places. And so if you're not feeling good and you're noticing that it's happening for quite a lengthy period of time, know that it's going to cause problems with your body. Know that you're not going to show up the way that you want to. Know that there are blind spots when you have certain mental health conditions where you may not realize how sick you are. It's like having your shoes untied, someone bringing it to your attention that your shoes have been untied for hours. And so, we need to make sure that we are taking the time to really just focus on ourselves, focus on my thoughts, focus on my body, focus on my mood. And if you're noticing that you're talking to people less, that you're spending more time by yourself, you're starting to have a general, negative outlook on life, and you're not sleeping well, you're not eating well, all these things are adding up, then it's definitely time to talk to someone. Definitely time to talk to professionals. So just keep that in mind, okay? Also, if finances are a bit of a barrier, just know that many cities have community clinics. In Atlanta, we have Grady outpatient mental health clinic that's been open this entire time during the pandemic. They take walk-ins, and so if you really want to know where a starting point and you're not sure you want to spend money doing this or that, a community clinic is a really good way to start as well.
Well, thank you all. Thank you, Dr. Jordan Brunson, Dr. William B.J. Hicks, second, Dr. Thomas Oden. Thank you so much for this timely, important, vital, integral, and all too prescient information that you shared. And I greatly appreciate it. And I know that any and everybody who watches this will learn, and hopefully we will all do what we need to do to improve our health and wellness. So on behalf of the Morehouse College Office of External Relations and Alumni Engagement, I thank you for your time and your talent, and most importantly, the treasure of your brilliance that you've helped share today. So thank you so much. Also, thank you for the Pink Frog Foundation, who does outstanding work, and thank you for their sponsorship as well of this event. So thank you so much, gentlemen. I sincerely appreciate your time, and I hope that you have a great homecoming weekend, however you decide to celebrate. I hope you have a great homecoming weekend, and thank you so very much for participating.